Hi, welcome caregivers. Today we're going to talk about the Social Security Disability and Medicare. As always, the information should not be used as a substitute for advice from appropriately qualified licensed practitioners of medicine, psychology, ADA, law, or financial planning. On the expanded disability scale, we are at a level 2, which is minimal disability. So the reason for this topic, if you've been diagnosed and you know that you're probably going to be going on Social Security disability, is just to make sure that you have a plan for insurance, because once you go on the disability, you'll have a 2-year time frame before Medicare will kick in. So for the resources, they'll be linked in the website in the comment section. But basically, it's really just there's a lot of internet sites available through Medicare and Social Security Administration, and then support groups. So my recommendation, if you have the opportunity, is to look at health coverage and secure health coverage before you actually go through the disability process. And what happens is typically you'll go to your doctor and you'll get a verification form or a letter from them. Then you go to the Social Security Administration office or online and apply for Social Security disability. After that, usually go to the Secretary of State and get your handicap tags and things like that. At that point, you won't be working, so you'll have a 2-year time frame where you'll need to figure out what you want to do for health coverage, and then determine once you do get Medicare to do an Advantage or supplement plan. So the main options for healthcare coverage are through an employer or COBRA, healthcare.gov, using a short-term insurance policy, or doing nothing. So with the first one, if you were employed and going on disability, or the spouse was, they have the option to use COBRA, which is typically pretty expensive because it's going to be what the employer is paying, but it's sometimes can be better than what you might pay on the open market. The second option, going to healthcare.gov, will go into a little bit of detail to show you how that works. There's also short-term options, which is basically not your typical healthcare coverage. It's just more catastrophic. So if you're not going to be doing like routine visits or anything like that, it's just, it's something that would cover you if you got into a car accident kind of a thing. Or the last option is doing nothing. So if you go to the healthcare.gov page, they have a quick tool that's easy to walk through so you can do a quick comparison. So you can skip the plan ID, determine if you want to look at one individual or for the whole family. It'll ask if you're married, how many dependents that you want to claim. In this case, we'll put in 2. It'll ask about the age, and then find out if you're eligible for other healthcare coverage, if you're the parent or legal guardian, if you're pregnant or a tobacco user. And you can see it's very intuitive. They're not asking a lot of questions about pre-existing conditions, which is good. Confirm your household members' information, then you'll put in your typical or anticipated salary. Then it will show you just a quick estimate. And then the nice thing is that it will give you plan comparison. So bronze plan means that you'll probably have less out of pocket initially, but you'll have more that you'll end up paying as far as deductible. So it'll give you a quick summary of what your deductible will be, and then your total expected out-of-pocket expenses, depending on the type of plan. It'll give you a rating, so you can look at those. You can also do a side-by-side comparison. And then what you want to do is you want to look at any sort of drugs, prescription drugs that you might be taking. So you can see if, let's say, Provigil is on there. With that particular plan. And then you can also go back and then look at if your providers are in the system for that particular plan. You can also look up dental plans and then sort by premiums or deductibles. So if you look up a low deductible, you can see that you'll have a higher estimated monthly premium. So I hope that helps. So for the Plan, Do, Check Act, for planning, you just want to make sure that you understand what type of health coverage you'll want while you go on your disability until the time that you qualify for Medicare. So for Do, just make sure that you set up the coverage that you want, and then check to make sure that the plan is working for you, and then adjust your plan as needed. In conclusion, I wanted to end with a quote from Gandhi, which is, "It is health that is the real wealth and not pieces of gold and silver." And I hope that this video has been a little enlightening. I know it's very high level, but I just want to make sure that you're prepared for the next phase. Please hit like and subscribe, and if you have any comments, please leave them below. Thank you.